Hello and welcome. My name is Shelby Riles, and I'm with Community Health Works. We're a nonprofit organization working to make Georgia communities healthier. Today, we're covering cervical cancer prevention. The theme of our presentation today is that cervical cancer is preventable. In fact, cervical cancer is the only cancer that can be prevented by regular screening and a preventative vaccine. Here are some quick facts about cervical cancer to get us started. To begin, it is the fourth most common cancer in women, and most are caused by HPV. I'm talking 99%. Second, according to the American Cancer Society, over 13,000 cases will be newly diagnosed in the United States this year. The third fact is that the PAP test, human papillomavirus screening test, and the HPV vaccine can play a large role in prevention and early detection. In fact, HPV is the #1 cause of cervical cancer. It can be passed from one person to another by direct contact through sexual activity. This includes any sexual activity, like vaginal, anal, and oral sex. HPV can be spread even when an infection doesn't show any signs or symptoms. Human papillomavirus infection is the most important risk factor when considering cervical cancer because nearly all cervical cancers are caused by HPV. HPV vaccines are so important because they can prevent infection and is the best way to prevent numerous types of cancer caused by HPV. Vaccines are approved for males and females. They're only used to prevent an HPV infection. They don't treat one. To work best, it should be administered between the ages of 9 and 12. Teens and young adults aged 13 through 26 who have not been vaccinated and haven't received all their shots are still eligible to finish the series. These are the questions that we often receive when people first learn about the HPV vaccine. The first one is why do children need the vaccine at such a young age? The answer is because HPV vaccine has the best chance of preventing infection if it's completed prior to ever having sexual activity. The HPV vaccine can only be used to prevent infection. They don't help treat any existing infections. The second question that we hear a lot is, why does my son need the HPV vaccine? And the answer is because HPV can infect men too. It can cause cancer in men, like oral cancer, anal cancer, and penile cancer. The last question that we get a lot is the vaccine safe? And the answer is yes. The vaccine is absolutely safe and effective at protecting boys and girls against HPV-related infections. Now, we're going to shift gears and talk about screenings for cervical cancer. The goal of a screening is to detect cancer early so that it can be taken care of early. The later that cancer is detected, the more likely it is developed into a more serious case. Screenings effectively reduce the likelihood of developing a late-stage cancer because they're meant to be completed on a regular schedule with a primary care physician. If you aren't current on your PAP test screening, it's time to get it done. If you aren't too familiar with female anatomy, you can use this depiction as we go over the steps in the PAP test. The PAP test is a procedure where your healthcare provider collects a sample of cells from the cervix so they can be examined closely in a lab to assess for cancerous and precancerous cells. A lot of people are afraid to get the PAP test done for various reasons. Maybe they're afraid of the results, but as we just covered, it's best to detect cancer early because the sooner you test, the sooner you know, and the sooner any potential cancer can be treated. Or maybe it's because people are afraid of what the process is like if they've never had it done. It is as easy as 1, 2, 3. The first step of a PAP test is that your physician will insert a speculum into your vagina and gently open it to separate the walls. Step 2, the physician inserts a small swab and gently collects cells from the cervix. Then, the collected cells are sent to a pathology lab for testing. Your doctor will be in touch with the results. And you might be wondering how you could afford a cervical cancer screening. And the thing is that screening coverage is mandated by the Affordable Care Act. Those with Medicaid, Medicare, and most self-insured plans are 100% covered. If your insurance plan was in place prior to September 23, 2010, you need to check with your provider to see what is covered. Policies since that date are required to include coverage for cervical cancer screenings. If you don't have health insurance, don't worry. Call the Department of Public Health's Office of Women's Health to see if you qualify for the Breast and Cervical Cancer Program. Their phone number is listed here on the screen at 404-657-6370. And you might be wondering, how do you schedule your annual screening? Well, you call a doctor. This needs to be a primary care doctor or an OBGYN doctor. If you already have one, call them. If you don't, you can find one and schedule an appointment. It's very important to do this. Once a year, you need to be screened with a pap test. And if you don't have a primary care doctor or you're not interested in that, at minimum, an appointment with your local health department is another option. Anyone can get screened at the health department with an appointment. Cervical cancer is entirely preventable, and I hope you understand that after seeing this presentation. If you have any questions about the material that we covered today, let's have a talk. Give us a call or feel free to send an email with any questions that you may have. And if you're interested, you can learn more about cervical cancer as well as many other health-related topics, including more cancer prevention, on our website, pictured here on the screen. And if you don't already, go ahead and follow us on social media so that way you can keep up with everything that we have going on and you can stay in the loop about what health topics we're covering next. I hope you learned something from this presentation, and remember, cervical cancer is preventable.